Prescription for Life is brought to you by Suretime Emergency Medical Services. Worry less, live more. Call 906 SURE.
Good evening, listeners. Good evening. We're live inside the studios at Nationwide 90 FM on this Tuesday, September 19, 2023. Yes, we're live and direct. Bob Marley asked famously if you know what live and direct mean, and the crowd said, what? Him said it mean live and direct. We're coming to you live and direct from the studios of Nationwide 90 FM with Prescription for Life, brought to you by Suretime Medical. My name is George Davis, the star of the show, the man of the hour, Dr. Andre McDonald. Good evening, sir.
Good evening, George. Bob Marley did not care that you cannot use a word to put in the definition of the same word.
But it's so practical, him say, coming to you live and direct. You know what live and direct mean? It mean live and direct.
And everybody understood.
Yes. Only Bob. Well, all right. This evening, listeners, we're coming to you with a topic. It is... All right, how do I put this topic now? It is a topic that, like everything else we do here on Prescription for Life, it is particularly important. And there are many people who, having done this thing that we're going to talk about tonight, realize the danger that their life is in. Realize things that are affecting their well-being, not just their wellness and their health, but their well-being is being affected. And they said, well, if I didn't know how to do this thing long time, and after doing it themselves, they recommend various family members, if not all, to do this thing so that you can at least know what, if anything, is causing you not to be enjoying a very, very high quality of life. What am I talking about? It's the simple sounding medical checkup. We're talking about a general medical checkup this evening. It's something that people take for granted, people with children especially. No, him alright, and him healthy, and him run and him eat enough and him sleep at night time, then in a checkup. Then you check up and you realize that the child has certain issues that is causing them to not perform optimally at school, or even deeper things that are suggestive of behavioral problems that causes conflicts and causes difficulties in the child's interpersonal relationships. The medical checkup, people, is not something to be sneezed at. Doc, am I correct?
George, if you talk about stories, and by now my staff, my friends, and certainly the listeners on Nationwide will tell you that I have a lot of stories to tell, and every single one of them, George, is a true story.
Yes, man.
Just so many. The medical checkup has given me more medical stories to tell than anything else, and so we have a whole host of them tonight. A gentleman came in, 47-year-old, came in, and he said, I listen to you and George sometime, but let me tell you something about me. I hate doctors. That's how the man greeted me, sitting before me. And say, I hate that. And him said, Doc, I not only hate doctors, but I hate doctors with a poison. The man is listening to me now,
Yes.
Because he has become a good friend of mine.
Yes.
This gentleman had a very bad experience at a public hospital in Jamaica with his father.
Mm-hmm.
And since then, he has... he told me that he hates doctors with a passion, and he's only coming here because his wife got mad on him
And
insisted that he needed to come. And he's saying, Doc, I don't know why she getting mad, because I'm just tired.
Mm-hmm.
I'm just tired. Sometimes the vibes is not there, and I put vibes in quotation marks because his definition of vibes not being there was that his erectile function was no more good enough to please his wife, but he just said it's because he works hard and he's tired. The bottom line is that when this man was evaluated by the nurse, his pressure came back significantly elevated, and when I spoke to him, I realized he was passing urine very, very frequently, along with him just being very tired. We did a number of investigations, George, and we realized something we have spoken about on this program before, that is HbA1c was very high. As a matter of fact, it was 12 point something. Remember, normal is less than 5.7.
And it was
It was 12.
double that.
It was more than double.
More,
Yeah, it was 12.7, and I'm seeing his cholesterol was also ridiculously high. It was 6 point something, about 6.4, I believe it was. His ECG was very abnormal, and he was asking me, Doc, what all of this mean? This is a man who has not been to the doctor in over 3 years, and you're going to see the value of 3 years. I want the listeners to listen to 3 years and why that is significant.
Yes.
He has not been to the doctor for over 3 years since his father has passed.
Yes.
And he now presented over 3 years later with a diagnosis now, as labeled on him by myself, as being hypertensive, diabetic. He had elevated cholesterol. He had an abnormal ECG. So he had some heart disease. And the one he really came for, loss of vibes. I also diagnosed him as erectile dysfunction.
That's a lot of things wrong.
That's a lot of things. This he did not know. And what you're calling the General Medical Checkup, as we will hear from some of our figures tonight, has the potential of revealing a lot of unknown things, especially what we call silent killers to persons, especially in Jamaica land we love, that they had no idea about.
Yeah. All right. So if we get into a medical definition, a textbook definition of a medical checkup, and then a working explanation of what it is, I'm imagining a mechanic reporting to work. Someone brings their motor vehicle there and say, mechanic, I want you to service this car. You know the things you look at, you check spark plug, you check oil, you change filter. Those are the things you normally do. Then they say labor and so forth, and then they give you the bill, and when you come back and they say your car, all right, they check windshield fluid, wiper fluid, and check if your tire them all right, and that's that. That's a car. What happens for a human being?
Quality of health care, similarly to quality of car care, has two fundamental elements, George. One is that you want to treat any illness you see appropriately, and two, you want to prevent any illnesses from happening. And so the medical checkup is intended to be a preventative clinical evaluation, which means history examination, test score investigation, and treatment. So the medical checkup is a preventative. You want to prevent clinical evaluation, which aims, George, to allow for timely, and I'm using the word timely, detection of various type of diseases. You want to detect them in a timely manner, which, if you do detect, can result in early treatment, which can effectively prevent deleterious consequences.
Yes. All right. Good. So, in the same way that in a car checkup, every mechanic worth their salt check spark plug, because clearly spark plug gives the energy for many things to happen in the vehicle. What are those things that must be checked as fundamental points in a medical checkup?
Very, very good question. And so when somebody goes to do a medical checkup, and mind you, there are going to be several different types of persons, and when I say different types of persons, I'm talking about persons at different ages, George, persons different gender, and now you would understand that gender and its meanings have been expanded significantly.
Yes, sir.
Yeah, so that is going to be for another program. But before now, it used to be just male and female, but now a lot has changed, and gender presents risk factors. You want persons with different family histories.
Hold it right there, Doc,
Yeah.
on the point of gender and risk factors and family history. Let's take the break and come right back. This is Prescription for Life here on Nationwide 90 FM. You can call Suretime Medical. They're responsible for us. They're on they're at 10 Trafalgar Road in New Kingston. 394-5433. That's the 24-hour lifeline that you can get them on. 906-7873 if it pleases you. And yeah, you can get your medical checkup done there by the competent and professional staff. Welcome back to Prescription for Life here on Nationwide 90 FM, brought to you with the kind support of the good folks at Suretime Medical, 10 Trafalgar Road in New Kingston. 906-7873, that's your landline number. 394-5433, that's the 24-hour lifeline. General doctor's visit at Suretime costs you $3,500 and up. It starts at $3,500 for a general doctor's visit. Short time, they facilitate night care. They facilitate house calls as well. You can go online and find more information about what Suretime offers. Go to drsureonline.com. That's DRSUREONLINE.com. drsureonline.com. Of course, Suretime, they provide ambulance care, and you can get an ambulance wherever you are on the island. And yeah, it's just the people you need when you are in desperate need. All right, we're talking about medical checkup. Doc says that it's a window into a host of problems that may be affecting your health and well-being. It's not a simple thing. It's not to be delayed for years on end. You should do regular medical checkups so you keep a handle on the state of your health and wellness. Before the break, Doc, I was asking you that similarly to a car where there are certain fundamental things that those affecting the servicing of the car check, the spark plug and other things, for human beings with their medical checkup, what are those fundamental things that the medical professionals check for and check on?
Yeah. And we started by talking about some risk factors. And the reason why these things are important, George, because years ago, what we call this full body physical. And I guess it means you just go into a doctor and they probably ask you some questions, do an examination, and then do everything. There is a particular battery of blood tests, and that goes with a name that people will come and say, oh, I want to do this blood test.
Yes.
Yeah. And while this is something that is present on many lab forms, it was never something that was ever taught in medical school.
Oh.
Right? And it is not something that is endorsed by any medical journal either. But it has become popularized.
Yes.
These various profiles have become popularized, and so even doctors themselves catch on to them or is caught by them and say them, but it's not something that they were taught, and it's not something that is actually encouraged. As a matter of fact, George, it is actually discouraged.
Oh.
And yes, and the biggest part of this program today is that the general checkup for a particular patient that is less than 49 years old, that has no illnesses, no chronic illnesses, George, that person is supposed to visit the doctor once every 3 years. Believe it or not.
Below 49.
Below 49.
Yes.
49 and below. Once every 3 years, the doctor is supposed to do a history, is supposed to do an examination, and if their vital signs, we're talking about blood pressure being less than 130/80, pulse, respiratory rate, and others being within normal range, and doctor picks up no physical challenges, then the doctor is not supposed to willy-nilly say go and do one of these profiles. It is highly discouraged, and the journals are showing that it adds absolutely no benefit to one's life.
Yes.
Very important point to make. A big study was done, George. Huge study, 180,000 persons. And what that study would have shown, George, is that after all of those studies were done, all of those studies were done blood studies, these profiles that persons request and always send you to the lab to do, it did not affect mortality rate at all.
So what's the benefit of doing them? Someone is asking.
Well, the benefit of doing them, George, based on the studies, it's no benefit at all.
There you go.
It's no benefit at all. And this is a big point I want to get out. And this is why that question you ask is probably the most important question. It sounded so simple.
Yes.
But it's probably the most important question for the radio program.
Yes.
Because we are saying that if you're 49 and less, and you have no chronic illness, and you have no risk factors, and you're not sick, you need to go to the doctor in every 3 years.
Yes.
And if when the doctor examines you, everything is normal and everything is fine, these profiles must not be requested.
Yes.
What we have in Jamaica is that a lot of persons do these things routinely. They swear by them. They're happy about them. Many doctors even send them to do them. And there are many persons who actually go to their medical doctors and request them.
Yes. Send me go do one blood test now.
Yeah,
Do one.
exactly.
Yeah.
But we have seen that with these big studies, doesn't change the mortality rate at all. Doesn't make a difference, and therefore, it is strongly discouraged. What is encouraged is that you look on the person's age. So, for example, when the person gets to 50 and above, you start now checking annually, because what we know is by 50, the burden of diseases and in terms of the incidences and statistics will indicate that persons must be checked. We know that men who have certain risk factors, they, for example, should do a PSA if they have a family history of prostate problems at 40.
Right.
But if you don't, George, then you wait until 50.
Yes.
For example, we know that if you're obese, which is another risk factor,
Yes.
then you need to now do blood profiles that are related to being obese. We know that when you have a waist circumference that is greater than 40 and greater for a man, 36 and greater for a woman, this is the time when you want to look at your sugar, HbA1c, your cholesterol profile, you want to look at your ECG, and you want to look at your blood pressure. Very important. But then you have a waist circumference that puts you at risk. Or if you are obese, as a matter of fact, if you're overweight, the studies say if your body mass index is greater than 25, that puts you in the overweight category. Then you need these investigations. If you're not, George, then you absolutely don't. If you have a family history, George,
Yes.
of like cancer, prostate problems, or breast or cervical cancer, then you start screening earlier. So family history now is amazing, George, because family history and a genetic predisposition can be two different things. Do you know that you can not be genetically disposed to being obese, but you have a family history of obesity because everybody in your family eats a certain way?
Right.
And so some of the times, and I see it all the time, I had a family who came to me on a health fair recently. Everybody was overweight. Mommy was overweight. Daddy was overweight. Son was overweight. But they all eat a certain way. Family history. But it doesn't necessarily mean that they have genes which predispose them to obesity. George, want to give you another one. Your environment. Dengue is something that is a challenge in the country today.
Right.
So if you live somewhere where you have mesh and you have no gullies around collecting water and no tires, and you ensure that the yard is clean and no mosquitoes are coming in, then you're not going to have mosquito-borne diseases. But if you live in an environment that incubates and facilitates such, you will have those sort of diseases. You see that?
Yes.
And therefore, if the person now comes presenting to you and gives that history and gives a history of a fever and a headache, you're going to want to do the dengue test, not true?
Right.
But it's not something you're going to just get up and do because dengue is going around in
Right.
Jamaica. And this is why the sexual practices, the socioeconomic status, the use of illicit drugs, all of these things have to be taken in consideration at the checkup, and it may facilitate a reason for the checkup. So remember, George, in general,
Yes.
if you're 49 and less,
Yes.
with no risk factors,
Yes.
no chronic medical illnesses,
And you're not sick.
and you're not sick,
Yes. Once every 3 years.
once every 3 years, and when the doctor examines you, he still believes the same, I am saying categorically the blood profiles are not recommended and they're futile.
Yes. All right. Here's where I want to go though. Where medical checkups are concerned, I don't know if you have the numbers. I hope you do. You almost always have the numbers. How many, in terms of a percentage, how many percentage or what percentage of cancers or chronic lifestyle diseases, the diabetes, the hypertension, and so forth, what percentage of those things are caught in a medical checkup? In other words, the person never feel like, say, boy, I don't really wrong. When I just go for a checkup, and Lord of mercy, can you imagine, say, doctor tell me, say, oh, this don't look good, and when them test and test and test, then call back for come on the doctor, may have cancer, may have diabetes, may have, I mean, never know, me did, you know, yeah. What percentage of those things are caught in just the general medical checkup?
That is a very, very, very good question, and I'm going to tell you that the figures for that is, I'm going to tell you why it's very difficult to present.
Yes.
And why they do not have many figures for that. It's a very important question, and is something we try to look for. So they have so many figures that they have presented, especially in Jamaica, in terms of chronic diseases. What is our burden of chronic diseases? The last study we have here is a 2019 study that will show us the top 10 causes of death, for example, in Jamaica, and how much per 100,000. What we do know in Jamaica is that 8 out of 10 persons now are going to be affected by a non-communicable disease.
8 out of 10?
Yes, we're talking about high blood pressure, diabetes, all of these things. This is where we're going, and or will die from. Yeah, and the other two, some sort of violence
Gunshot.
or gunshot or
mercy.
motor vehicle
I
accident.
don't know if it matters, but
Yeah.
I'm just saying, yes.
Yes, as to how many of them are picked up when they just go for a routine visit is very difficult to see.
Yes.
Because most persons who actually go do not go for a routine visit, a general medical checkup, but they go because something is wrong.
Right.
And when they go, something else is picked up.
Yes.
If you follow what I'm saying.
But that's why I asked the question.
Yeah.
Because remember, you spent a lot of time telling us about people who go and the age band that you're all right. So if you're all right under 49 and you know feel sick and everything, you know, you just need to go once every 3 years, so forth, so forth. So the natural question was to say, okay, how many of the serious things that affect lifestyle and life, how many of those are just picked up in the routine check?
So here's
Yeah?
the
But let's take the break first, because our producer is telling us to go. 8:29 on the clock. We want to take 8:30. We want you, if it is that you have any query where the medical checkup is concerned, you can give us a call, 618-8255. Tell me in the conversation, well, tell the doc, when was your last medical checkup? What did your doctor say? And what is the state of affairs where your health is concerned now? We take the break. We come right back. This is Prescription for Life here on Nationwide 90 FM. Welcome back to Prescription for Life here on Nationwide 90 FM. We're talking about the medical checkup. The medical checkup that Doc says is a window into so many things that may be wrong with your life and which may threaten your well-being over the short, medium, and long term. You say 49 and under if you are okay generally. You only need to do that maybe once every 3 years. But once you hit 50, then it becomes an annual issue. I want you to speak, though, to those persons who are in the broad category, a 30-year category, 30 to 60, you know that you're talking about people in the prime of their working life. You're no longer a young employee at 30 or a young entrepreneur at 30 if you run your own business. You've been at it for a while, one would expect. And up to 60 is when you're getting into, after which you're going to get into the retirement period. So 30 to 60 is a really important part. That's when people hustle. By 60, doc, you'll be wealthy several times over. Many people will have to go far beyond that. But 30 to 60, that age bracket, and the advice to them where medical checkups are concerned.
You see, George, you have been asking some probing and very important questions.
On form.
Yeah. And I tell you what, this is why we now want to say there will be a group of persons who are less than 49 that will require seeing their medical doctors even more than once a year.
Yes.
And this is now where we say to the listeners, we say to the men, 1 in every 2 Jamaican man is overweight, George. He has 1 in every 3 is going to have a waist circumference that is greater than 40. It's a lot of men walking around in Jamaica land we love with big waist circumferences and 1 in every 2 is overweight. This means, George, that as simple as that, 1 in every 2 Jamaican men need to go to the doctor and do a medical checkup because they now have put themselves at risk.
Yes.
2 in every 3 Jamaican women, the similar situation applies. They're overweight, and a significant number of them also are obese. So they have put themselves that they need to go and see the doctor. A man who knows, George, that his father had prostate issues should not wait until 50 to go and get his rectal examination and his PSA done.
Yes.
It's very simple. You know, if your mother or father had hypertension or both, or diabetes or both, then you know that you have a family history of.
Yes.
And therefore you should go to see the doctor for your general checkup.
Right.
Because the aim is, if you have that risk, then go see them. Allow them to ask you the questions. So the questions will ask you about your family history. When you relate that, George, then the doctor is going to do the relevant test. You know, that's a relevant test.
Yeah, man. Not just test for test sake.
Not just do a test for test sake and do a big battery of tests.
Yes.
Because it may be, George, that you have correct weight, you have a proper, a normal body mass index, and your blood pressure is okay, but your mother and father are diabetics.
Yes.
And they're type 2 diabetics. And when you get to between, let's say, your 3rd and 4th decade, that's when it becomes an issue.
Yes.
And at that point, your doctor might just want to do a HbA1c to look.
Yes. You know, there are people, and you say that there are people who, so for instance, so they'll tell you that, you know, sugar killed my mother at 54, and my father is still alive. He's 56, but he's lost 4 toes, and you still need somebody to tell you that you're 39 on the border of 40, and somebody need to tell you that you need to go to the doctor, go see if you're on that track. Just because you say that, well, when my mother was 39 and my father was 39, them did all right, so me not ready for go yet, me not need for go yet. But no, you see, your mother has passed and your father has lost 4 toes. You need to go like yesterday.
So here's the story. A patient last week I had was 30, was female, was obese, had a high HbA1c. She has a maternal history of diabetes, and we only did the HbA1c after talking. And she said, "Doc, are you saying that I'm diabetic?" And I said, that is not something I enjoy telling people. Yes. And so you're absolutely right. You must know your risk factor. Now, it cannot be that you have a family member who died in their 40s or 50s of cancer of a particular place, first degree relative, and you're going to walk around as if it's business as usual.
Yes.
It cannot be. So you now have to look at your age. Remember, the less than 49 is only one component.
Yes.
You see why we listed all the components?
Yes.
Because you have to look at your sex, meaning gender, meaning are you genetically male or female?
Yes.
You notice how I defined it?
Yes, ma'am.
Because then you're prone to, even if you are a male on the outside, but you are but you have ovaries on the inside,
Yes.
you have a womb on the inside, and you have a cervix on the inside, you're still prone to cervical cancer.
Yes.
You have to look at your sexual practices. If it is you're not vaccinated against human papilloma virus, very important, and you started having sexual intercourse from early, even if you would have decided to change. I have a patient like that I had to talk to recently. Change your sex, but you still have a cervix, then you still have to know, and I had to tell this patient, but you still need to do your pap smear.
Yes.
Because there is still a risk of cervical cancer. Remember, we did it on this program that 15 to 20 years is what the human papilloma virus takes after sexual intercourse to translate into doing the cancerous changes in the cervix. And so I said to the person, time is coming. You need to do that because your sexual practices were such
Yes.
that that can happen. So this is absolutely, you need to look at your environment, where you work, what you're prone to, right? So if you work in a smoke-filled
Yes.
area, tobacco smoke,
Yes.
then lung cancer
Yes.
is going to be a big
And that's where I was going, because I was saying to you, I'm remembering a time when my first job was in heavy industry, whereby the company manufactured sulfuric and sulfonic acid, and the emissions from the plant, regular plant maintenance, plant shut down and everything, and the men who worked in it, they said they had on masks. But you know what kind of mask they had on that?
regular
Dust mask. Dust, not even the COVID mask that we're wearing, the dust
Dust
mask,
mask.
right? And also, it was a place where a substance called alum was manufactured. Alum is
Exactly.
what? It's a water purifier.
It is. It's
yeah.
magnesium.
There you go. Yeah. And it fused with the yellow. There's a yellow substance that smells really pungent. What's it called? Sulfur. What's sulfur? It fused with that to create something. Anyway.
Yes.
So people work in that kind of environment, and then there's salt on
Yeah.
the same compound as well, the milling of salt and everything. So you would suggest that a normal 35-year-old or 40-year-old man in an environment, in an office building where the air is clean and everything, wouldn't necessarily need to be doing the kind of checkups with the frequency that someone who's in that environment every day, walking around in a dust mask and feeling like they have protection from the fumes around and the dust and everything else, just because of that dust mask.
That is clear, George, and we have seen some studies where persons who live in a particular country, in a particular part of the country, live not only to a ripe old age,
Yes.
but without a lot of the chronic illnesses that we see, and therefore the aim and the purpose of that general checkup is to assess risk factors. So your evaluation, which is your history,
Yes.
talking to the patient,
Yes.
your examination, which is usually a physical examination, is done looking for any possible challenges, but also in your mind targeted to what the history says.
Yes.
So you're going to pay special attention to the lungs, for example, if the person is
Yes.
coughing, if they're a smoker, if they were in a smoke-filled environment. Your investigations are going to be now tailored and targeted to the particular area. Because one of the things you will find as doctors is some of the times when you do these big batches of tests, some of the times they just come back normal. And if you would never look for specific investigations to target the history and the examination, you will miss.
Yes.
And therefore, if you need to now treat, George, then treatment must be based on the underlying
What's the
cause.
guidance for children though? Because if you notice, we started the program and I spoke about children extensively in that opening, and the guidance where the frequency with which they should be subject to a medical checkup.
Yeah. And I'm going to give some guidance that I'm going to expand on in that program that we advertise is going to be coming up soon. Parents must look at their children very carefully. One of the things that I want to reiterate is that parents will see children and will see things that does not look so right. Children will benefit from the medical system because they would have been immunized early. They would have had early checkups as babies. They would have visited at least the health center several times or their private practitioner several times to benefit
Right.
from that immunization schedule. The expectation is if that nurse or public health nurse or nurse practitioner picks up something, even if they're not seeing the doctor per se, that must be pointed out. If the child is not ill, and that doesn't happen to many children because children tends to get ill often.
Yes.
Then you will find out that many parents will not take them to the doctor. There are parents, when we're doing checkups now, and I saw that with a lot of first formers when we're doing medicals.
Back to school.
Many of these children, and we saw hundreds, George, are seeing the doctor for the first in a long time.
But you made the point that many children see the doctor all right, so a 10-year-old comes to you, an 11-year-old or a 12-year-old, and you say, "Mommy, when last this child saw the doctor?"
4 years
You're
old
looking at the immunization book,
That's
and
it.
the last immunization shot was the last that they saw.
Exactly. Which is 4 to 6 when they would have gotten the last
Yes.
MMR shot.
Yes.
Yeah.
And that's not advisable.
Well, it is not advisable, but the truth is, if it is that the child is healthy,
Then
and do not need to see, the mommy is not going to bring them.
there you go.
Yeah.
And as I say, the
And
child don't sick, child not got a doctor.
is not going to go. The issue is the mothers and the fathers and the aunties and the guardians and whoever is looking over the child, big sisters,
Yes.
have not been so vigilant.
Yes.
Because you know what happened, George? They are missing stuff that we find on these medicals.
There you go. It's time to take the final break on Prescription for Life here on Nationwide 90 FM. More after these. Back with us on Prescription for Life here on Nationwide 90 FM. And I must tell you about an effort that our good friends at Suretime Medical are assisting with. They're advancing. They're collaborating with the JDF for a health fair at Calabar Junior High, Calabar Infant and Primary School. Yes, Calabar Infant and Primary 2 Sutton Street in Kingston. And they go from 9 a.m. till 4 p.m. 9 a.m. till 4 p.m. It's a health fair. And the things we've been talking about here are instructive because I'm sure the parents are listening and they'll want to, they have a child that they want the doctors to look at, or they themselves haven't been to the doctor in eons and want to take the chance. You can go on down to that health fair on Saturday, September 23, 9 to 4 p.m. Calabar Primary and Infant, 2 Sutton Street in Kingston. Health Fair Suretime collaborating with the JDF outreach effort. And yeah, it's going to be worth your time is the point I'm making. All right, so we're in the final segment. We're talking about medical checkup. And Doc, I asked before the break about children, and we've agreed that if a child is not sick, the parents won't take that child to the doctor, and that many children, after seeing the doctor for the last time to get their final set of immunization shots for the rest of childhood, no doctor, especially if they appear to be hale and hearty.
One of the things about the general medical checkup, and it has 3 basic functions: prevention. What is called primary prevention, what is called secondary prevention, and what is called tertiary prevention. That's the purpose, really, George. Primary prevention, George, is important. Why is that important? Because it allows you to prevent diseases from happening, period. And this is why the child will go and get immunization.
Yes.
You just said it. That is what primary prevention is. So you get a shot, MMR, for measles, mumps, rubella, so that the child never gets that. That is what children do. The thing is, if that child is allowed to eat all that he wants to eat and become obese, and he's allowed to, from 4 to 6 you'll get your last immunization shot. And you're absolutely right, we never see that child a lot of times, George, until the child is 12 years old.
Yes.
At first form.
Yes.
When it is mandatory.
Yes.
That you get a medical to go in. That child has been using his tablet. We have spoken about this many times on this program, and watching television, how many hours for the day. Screen time is not the less than 2 hours a day that we ask for, but we're talking about all 10 hours.
Yes.
And damages their eye. The mother notices, without noticing, that the child's grades has dropped, or that the child now has to go closer to the television to watch, or that the child holds the phone or the tablet close to his or her face, but is not paying attention to that. And this is why I said before the break that they will observe but they will miss, because this is unusual.
Yes.
They will notice that the child's behavior has changed, and that the child is uncooperative with school and work and discipline, but they will miss it because they think that this is a normal way for the child to grow.
Yes.
When the child gets to me now or any other doctor at 12, and I'm saying we saw hundreds of children, the results that we saw continues to be appalling.
Yes.
A number of children are what you call legally blind. 2020 is supposed to be normal without glasses. 2025 is where it stops. At 2030, you want to start seeing the eye doctor, the ophthalmologist, because the eyes have deteriorated to the point where glasses are needed. Well, on the health fairs recently, we saw a whole lot of 2060s, 2080s, 2000s. These children were legally blind. They're in school. And then I remember asking one mother recently, so how does a child do in school? Well, I've got 30s.
Averaging 30s.
30s.
Wow.
And they would have been placed at a school that wouldn't have been the school of their choice.
Yes.
And I'm saying to mommy, when did you notice this? Well, she used to do well in grade 1 and grade 2, but between grade 3 and grade 4, I don't know what happened, but I just thought she was going through a phase. Look here, if you notice something, George, is not right with a child, that child must see the doctor.
First course of action.
Must go and get a checkup.
Yeah, man. First course of action.
We had children who are not hearing well.
Yes.
Let me not talk about the dental caries.
Yes.
Amazing.
Yes.
And this is why this outreach that you just spoke about, for example, will have dental professionals. We're going to be looking at dental challenges. This is why we have eye professionals. It's good because we have eye professionals from 2 different institutions, George, that will be coming in so that we can examine not only adult eyes but children eyes.
Yes.
Can you believe?
Yes.
All of this for free.
Yes. The issue of dental care as part of a checkup, people don't understand how important dental care is to optimum performance in anything, because a part of the standard medical that footballers do when deciding the multi-million pound or US dollar contracts, you have to have a proper dental check and you have to meet certain standards. You can't have cavity and be a professional footballer. And also, when you talk about dental health, it's not just in humans, and I'm not straying, but I'm making a point that needs to be illuminated in this way. Racehorses, thoroughbred horses, a lot of times when they are not performing up to optimum standards and the trainers can't figure out why this horse not running well, they bring in a dentist and say, oh, trainer, they've abscessed there or this, that, so they're not holding the bit properly, and you fix that, horse start run like a machine. So dental health is so important, and you pick up these things in the medical checkups that we've been talking about all evening. Otherwise, just think about the pit, they just get done, or something happen, but you not even realize that it's an issue that simply could be fixed if spotted early, taken care of, move on from there.
Pain, George, pain in the mouth. is a significant reason why a child will not learn. Can you believe that?
Yes.
Just pain. And parents must know that there are a lot of parents who are okay with looking into the child's mouth and seeing all of these dental caries and accept it as something that is normal. It is absolutely not. Had a young child, probably about 5 years old, on one of the health fairs that we did.
Yes.
Back to school health fairs. And that particular child, he was eating a sweet. When I asked him to open his mouth to examine it,
Yes.
it was full of red and all sorts of colors with sweets, and behind all the sweets were the rottenest teeth you could actually find. And I'm saying, young child, and I'm saying, Mommy, what is happening? What is happening? And she said, boy, doc, and the child was overweight. And she said to me, boy, doc, me can't stop him because his father give him the money, and what he does is go down the road to the shop and just buy sweets, and he eats so much sweets that she said some night she has to take the sweets from his mouth when he has fallen asleep.
Oh my.
So he doesn't brush his teeth before he goes to
Bacteria
bed at
dream.
night. So it is a bacterial flourish.
Yeah, man.
They would love that environment because they get to now multiply, live, and this shows you why this will happen. So this is what I talk about when parents need to be more vigilant.
Well, short time, they facilitate house calls. They run a 24-hour medical facility. They provide island-wide ambulance coverage, and it's not just about serious health issues. If you want some nutritional advice, you can get it there as well. You can call them 906-7873-394-5433 or visit them at 10 Trafalgar Road in New Kingston. We'll be back next week, live and direct for you, like Bob Marley. We'll be right here inside the studio. I want to say thanks to Amiche Dean. I want to say thanks to Madam Producer Latoy Lawrence. I want to say thanks to Andrew Anderson, the technical man. And yeah, his waist circumference, Doc, you know, them on the need for God, Doctor. Them on the slip. Doctor probably tell him same underweight.
That's another program.
Yeah, man. Them on the underweight, man. Alright? Viewers, listeners, see where I'm coming from? Viewers, it's still in me. Listeners, good evening. This has been Prescription for Life here on Nationwide 90 FM, brought to you by Suretime Medical.